Hi, my name's Abby and I'm one of the surgeons at Veterinary Specialist Services. And we're going to have a little bit of a chat about looking after your patient post an abdominal surgical procedure. So your pet may have abdominal surgery for example, a spay or basically any other abdominal surgery. And you'll notice that your pet has a wound on their belly, and this wound shouldn't be painful to sort of touch. Now, don't touch the wound directly, but there shouldn't be any sort of pain, just with gentle pressure around the wound. And the same for the abdomen. There shouldn't really be any pain with just light pressure and palpation of the abdomen. Now, something else that's very important is just to keep an eye on your pet's colour. Now, it's rare to have any sort of complications such as a bleed after abdominal surgery, but of course it is possible. And what you'll notice at home is that there'll be a change in your pet's colour, and they may also be very lethargic. So I'm just going to show you the sorts of things that you can do just to check the colour of your pet. So you can gently just have a look at their mucous membranes. So there's the mucous membranes around the eye, and you can see here that they're nice and pink. And then again, in the mouth, you can see that the mucous membranes are nice and pink. And if we gently press, you can see that basically there's a slight loss in colour. The colour changes to pale, and then basically the pinkness should return fairly quickly within about a second. So if that's not the case, if you're noticing that the mucous membranes appear pale or white in colour, then that's certainly an indication to seek emergency veterinary care. Now, the other thing to watch out for post-abdominal surgery is any vomiting or diarrhea, and those would be the sorts of things that you should immediately call your vet and just ask whether or not that's to be expected, which usually it would not be. And the other thing is if they're not eating. Now, that may not be anything to be concerned about. A lot of dogs will take a little bit to start eating after an abdominal surgery, but certainly if you're concerned, then it's best to just check in with your vet and see whether or not they're concerned about that or not. So one other thing about the abdominal wound, and this wound is covered, but in an uncovered wound you'll be able to just check for any redness or weeping, and those would also be indications just to let your vet know that there may be a problem. So just to recap, there should be no pain, just with gentle pressure around the wound or around the abdomen, and your pet should be nice and bright and have a pink colour. And we've discussed how you can check their colour and just make sure that it's nice and pink. There shouldn't be a lot of lethargy, they shouldn't be very sort of unduly tired, and really there should be no vomiting or diarrhoea, and if there is, then that's an indication just to get in touch with your vet. One further thing, they may have a light dressing where their catheter has been placed, and that can usually come off when you get home. So if you have any other questions whatsoever about managing your pet at home post-abdominal surgery, then please give us a call here at Veterinary Specialist Services.